Hi there, Unite for Her community. Sue Weldon here, and welcome to our very first Ask the Expert series. We at Unite for Her, the community, we get asked a lot of questions, right? And we have such an amazing team with us. I'm actually here with Dr. Linna Li, who is our chair on our board, but she's also the System Division Chief of Mainline Health and Radiation Oncology. And Lena, I'm so glad that you joined us today because, this is such an important topic. For us at Unite for Her, we're approaching all different types of topics. We're going to do it once a month. And we figured this month, timely, we would kick it off with understanding a little bit more about the COVID vaccine. So I have 10 questions that we've been working on, you and I, thank you very much, on what we think the community wants to hear. And hopefully, if you are watching us, we are live. I can see the questions coming in on the chat. So feel free to use that chat. Lena and I, I'll vet them for you, Lena, in case you don't see them. I know that you're on, your phone, so it's a little bit harder for you to see. But I will vet them. And yeah, hi there, Cam. Good to see you. I'm glad everything's working. Always good. I was joking with Lena. I'm like, we are not a professional studio, but we are getting darn close. We are getting close. All right, Lena. All right, first question. So what vaccines are available? We're hearing a lot in the news about what companies are out there and what vaccines are available and how are they different?
Yeah, there are two vaccines that are FDA approved right now. One is from Pfizer, and that is covering all anyone who is 16 and older. It's 2 doses, the first one given, and the second one is 3 weeks later. The second vaccine that's FDA approved is for anyone 18 and older. It's also 2 doses given 4 weeks apart. They're very similar in efficacy. Both will have a 95% effective rate at preventing having symptomatic COVID, and they both report 100% rate of preventing severe COVID.
Wow.
Yeah, it's pretty incredible.
It's incredible.
Really exciting time to have these vaccines be available. So this is a great topic for today. They're also a little bit different than our traditional vaccines. Traditional vaccines are made by growing the usual virus or bacteria in either egg cells or other humans, mammal cells, and then they harvest them and kill them and take pieces of dead vaccine and inject that into patients. There's also live vaccines. The current COVID vaccines are neither. They are both what we call messenger RNA vaccines. What that means is that the messenger RNA will go into a patient's cell, and those cells will create a small piece of the virus, and that allows our immune system to learn to stop the virus and to prevent it from having severe infections. And that really also gets to a lot of the misinformation out there. This is an RNA. It will not alter someone's DNA. This is not a live vaccine. You can't get COVID from the vaccine.
Okay, terrific. Can you tell us, Lena, about the new strands that are found? I know that is like all on the news right now, right? That there's these new strands out there, and that we get the right information.
So there are 3 strains that are of a concern to the whole world, and that these 3 strains, one from UK, one from Africa, one from Brazil, they're slightly different in that it seems, and we don't have a lot of data because we started tracking this probably end of November, beginning of December, so there's not a lot of information, but it seems like these strains are much, much, much more contagious, which is why we why we would like to vaccinate as many people as fast as we can. So that's one of the other reasons for maintaining our current health guidelines, wearing masks, keep
Let me decline that one. Go ahead.
Yeah, and staying safe until you actually have an opportunity to get vaccinated, and that's also what has prompted the government to change the travel guidelines and why everyone coming into the country from a foreign country has to be tested. So they are of a concern, but that's why we're getting vaccinated.
Yeah. Good. Now I see there's questions coming up. I'm going to go through all of our questions only because I know you're going to answer some of them. So if you could just sit tight, our audience, and you're going to hear a lot of your questions being answered through our discussion. Okay, the next one is, will the vaccine make me sick? What are the side effects?
The side effects are very common to the typical vaccines that everyone has had, like the flu vaccine. Obviously, there's going to be a little bit of pain in the injection site. You can have a little bit of fatigue, headache, muscle pain, some chills. These are all fever, just not feeling great, or have your lymph nodes feel a little bit swollen. And these are all very mild and extremely transient, so that even when someone has it, within 48 hours or at most 72 hours, it goes away. Because of the lymph node swelling and the soreness at the injection site, since we are talking to breast cancer women, I do recommend that you get it on the side that that's opposite of where you had your surgery, especially your sentinel lymph nodes. If you had that taken out, you should probably get it on a different arm.
Okay, terrific. I know that some, I've been hearing, we hear chatter, right? We hear social media, and a lot of people, not a lot, but there's some that are worried about fertility issues with this vaccine. Can you just talk a little bit about that?
Yeah, there's just so much misinformation out there. So in the history of vaccines, there's absolutely no evidence that vaccines affect someone's fertility. In fact, the OBGYN societies have advocated strongly for the FDA to allow pregnant women, because in the study that allowed FDA approval, pregnant women were included to make it simple. But they strongly advocated for pregnant women to be allowed to receive the vaccine now, because when someone is pregnant, they are slightly immune suppressed and they could have a severe disease during delivery. And the majority of my OB/GYN colleagues are recommending it to their patients. Also, this is safe in women who are breastfeeding. They can get the vaccine and continue to breastfeed. So that is definitely misinformation.
Yeah, it's good for you to reiterate that and just give us the facts behind it too. So I appreciate that, Linna. Should I get the vaccine, right? Like, this is a question that people are asking. Should I get the vaccine?
Absolutely.
Absolutely.
I mean, at this point, the U.S. Have had 28 million cases of COVID, and 400 plus thousand people have died from it. And we are still not living our normal life. And practically speaking, the only way for us to get back to normal is to achieve that herd immunity, which is roughly having about 60 to 80% of our population be vaccinated. So that is the goal. So absolutely, when it's your turn, please get the vaccine. In fact, in the initial clinical trials between both Moderna and Pfizer, it's over 70 plus thousand patients that were included in the safety and effectiveness trials, and that included everybody. There were over 7,000 people who are older than 65. There are over 7,000 African American patients that enrolled. There were over also about 6,000 Asians and another 6,000 Hispanics or mixed. And at Mainline Health, we've vaccinated over 12,000 members of the staff and now some patients, including 4,000 people of color. So it is safe, it is effective across all ages and all race.
Terrific. Awesome. All right. So now this is one I actually asked you this one. I was texting you the other night. Do kids or patients, active or not, and no matter how many years out, I know I had asked you, I'm 16 years out, right? Do we have a higher risk of having a more serious case of COVID being a cancer patient?
Yeah, this is hard, very, very hard to tease out because the news bits are very catchy. So I tried to look at some of the major studies So one, the largest cancer study that is out there comes from UK, and it's over 800 cancer patients, with maybe about a quarter of them being breast cancer. In the end, when they take into account whether they have had cancer treatments or other medical problems or age, in the end, what pans out is what you hear over and over again. The severity of disease is mainly driven by age, being a guy, and having other medical problems like heart disease, COPD, diabetes, high blood pressure. The largest breast cancer study that has been reported just came out through Breast San Antonio, that was reported in December. And it was about 850 breast cancer patients diagnosed in the US and in Canada. The 840 patients had COVID. And what they were surprised by was that 50% of these patients required hospitalization, and there was a death rate of 9%, which is higher than comparing to the general population. When I look through that study and get down to the nitty gritties, in the end, again, the biggest driver of how poorly these patients did were, one, being older, two, having many medical problems, again, heart disease, high blood pressure, diabetes, obesity, and active cancer. So that when you look at patients who are long-term survivors, if there's a slight increase of having more complications for breast cancer, we're not really sure, and we don't have enough numbers to show how bad it could be. But so far, what we're seeing is that having active cancer and being older and having other medical problems are the biggest drivers. But because we are concerned and we are seeing slightly elevated severity, we recommend everybody with having had a cancer diagnosis and it's now a survivor, or who is actively getting treatment, to get the vaccine, especially patients who are actively getting treated.
Yeah, that's actually my next question, Lena. So, we talked about if we were on chemotherapy, radiation. Actually, a couple of the questions in the chat were the same thing, discussing their type of treatment that they're on, what medications, hormonal therapy, radiation. So maybe you can dive into that a little bit deeper. Can you get the vaccine during that time?
Yes. So the American Society for Clinical Oncology recommends everyone with a cancer diagnosis, whether they are in remission and are not getting any treatment, they are just hormones like tamoxifen and anastrozole, Arimidex, Femara, or whether they're on immunotherapy, or whether they're getting radiation, all of it, or active chemo, to receive the vaccine. I have had one or two oncologists to say that we're not really sure about whether someone on immunotherapy should get it, but the official stance from the American Society for Clinical Oncology is yes. So it doesn't matter whether you're getting chemo for ovarian cancer, lung cancer. Yes.
Yeah. I know I'm going to bring up some of the chat questions because it's around this question in general. We have one, Emily had said that she had a reaction to Taxol, a med. Should I be concerned if I had a reaction to these two drugs about having a reaction to, and you're shaking your head already, to the COVID vaccine? Okay.
Correct. So we had briefly talked about this. If you've had so there's a difference between a normal reaction to a vaccine, which is injection site, everything I was listing earlier, fever, soreness, aches, chills, versus, so that's just a normal side effect and reaction to the vaccine, versus a true allergy reaction to vaccines, which is different. So most allergy reactions to vaccines are because the vaccines are made from eggs, but not this vaccine. As far as we know, besides maybe less than 10 to 15 cases that were reported for patients having a severe allergic reaction, kind of like an anaphylactic reaction. And that's why we monitor everyone who's getting vaccinated. That's why there's always you're required to sit for 15 minutes for everyone that comes through. And if you have a lot of allergies, you would mention that when you're about to get your vaccine. And what we do is we actually monitor you for about 30 minutes, so that it's safe. And if there's a reaction, it will be dealt with. Back to the original question, which is that does having a reaction to some of the other medications portend an allergy to the vaccine? Not that we are aware of. Yeah.
Okay. Yeah, there was a couple, another one, sort of referring to the same thing. Donna was asking, she's post-chemo, and I think you answered this, but I think it's good to hear it again. She's post-chemotherapy, who is now cancer-free. Is she considered compromised, eligible for the vaccine? And that actually, I signed up after you told me how to sign up on our county website, and that is one of the conditions that sort of puts us in the category if we had cancer in the past.
Yes. We don't have great data on survivors. We know for sure that the active treatment patients, especially lung cancer, have a very high risk of blatantly to die from COVID if you get it. We most likely there's a slightly elevated risk of having severe disease. As I mentioned, in that big study, 50% of breast cancer patients who had COVID had to be hospitalized. And I think because of this, it's included in the eligibility and why it's moved up to 1A. So if you have had a diagnosis of breast cancer, when you sign up and register, click on that high risk condition. And yes, I would get the vaccine.
Yeah. There was one other question, same, just same category. So Carol had talked about she had the virus 3 weeks ago, and the CDC states that she has to wait 90 days. She has breast cancer, started radiation. Does she have to really wait those 90 days?
So Mainline Health is doing 30 days. So I don't think we have a great answer to that either. I think 30 days is fine for, yeah. Actually, 2 weeks. We're Mainline Health is a little bit more conservative. Okay. I'm not sure if they've changed, if the CDC have changed, because I've heard 2 weeks and 30 days from being diagnosed with COVID.
Okay.
So not 90.
Okay.
Yeah.
Good to know. And then just one other thing, you talked about allergies, and then Kathy just had asked, she has a shellfish allergy. I'm thinking this is all in that same category that you said they're going to monitor you. You're going to disclose what you have, but she was just worried about the active shellfish allergy that she had.
Not that we're aware of. So there were only a handful of cases out of, at this point, it's got to be over more than 10 or 12 million vaccines that have been given. So if you really think about it, it's just so rare for there to be a true allergy to the current vaccine. And the way the old vaccines were made, it's a little bit different. And as far as I'm aware, shellfish have no, there's no cross with the makeup of the current vaccine. In the handful of cases that were reported, they were healthcare professionals too. They had, their allergies were so severe that they had to carry around an EpiPen. And that is why we need to monitor anyone with severe allergies. But even for the majority of people that have allergies, they're not allergic to these vaccines. Okay.
Good. There was one question here that came in, and that one was from Kathy as well. And she was like saying, why 2 shots? Why are 2 shots required? Is there a one-time vaccine shot available or, underway?
Underway, yes. So right now it's FDA approved for 2 shots and all the effectiveness that I was quoting you, the 95% of preventing symptomatic disease and 100% at preventing severe disease, is based on having 2 shots. There are a couple of companies working on the traditional way of making a vaccine, which again, is to take live virus, grow them, and then kill them, and then extract all the different fragments of the actual virus, and then give it to you. So that's the traditional way of doing a vaccine. Those types of vaccine development just takes a lot longer. They are going to be coming out. And when, we don't really know.
Okay.
I think that the boost is important. From what we could gather, one is probably not effective enough. It's still better than nothing, but it's not, at best, it's somewhere between 60 to 80% at best. It doesn't get us to the 95. The other thing with the boost is that, with the current way that we're developing the vaccines with the mRNAs, it's really neat because they're easy and they're fast to change. So that the 3 strains that I was mentioning, I believe Moderna is going to start working on a third dose to make sure that the new strains are better covered. They say that they're covered right now, and Moderna's might consider a third boost. So instead of having a second boost, there might be a third boost coming up.
Okay. That's good. So helpful, Linna. Thank you. I know you told me this fact, and I just thought it was really, I thought it was great to know that the medical community, I think you were talking about the medical community, everyone is going to be vaccinated by, the end of the month. Is that correct?
Yeah. So from in this region, I can't speak to obviously the rest of the state and country. In this region, all the major health systems have sent out invitations to their entire medical staff. And the majority of mainline health faculty have been vaccinated with their second dose already. So that was the same goal. It was the end of January was the goal for mainline health, and end of January was the goal for the Penn system, and I'm sure similar health systems in the region. In fact, mainland health started vaccinating all of our patients 75 and older. We believe there's about 16,000 75 and older patients in the health system, and about half of them have already received invites, and in the next 5 to 6 days they will have finished giving out tickets for that. And the next batch would be everybody else, high risk conditions including cancer, no matter what age.
Yep.
And 65 and older.
Yeah, and the cancer, no matter what age and how long ago you had it, correct? It's just in that cancer.
Yep, ever.
Yep. Okay, so how do I sign up? So that's one of the things I actually had to chuckle at myself. Sometimes I could be so smart and yet so dumb at the same time, And I was I know, I'm like, I just figured somebody's going to contact me. My doctor's going to contact me. But so how do we sign up, Linna?
So the message to everybody is sign up everywhere, and wherever you can get your vaccine, go get it. So whoever alerts you first. So the vaccine rollout has not been the smoothest. It's being controlled by the state, and the states are pushing it to the county, and then there are a few pharmacies that are contracted. So the first thing and the easiest thing is to register with the county that you live in. So just go to the county public health website. So whether it's Delaware County, Chester County, Philadelphia County, each of the counties have their own website and a registration. You can also register in the county that you work in. So if it's a different county, then you get to be listed twice. And in any place that you own a home, so many people have vacation homes at Jersey Shore, you should also use that address and register there. The next is patient portal. Most of our patients have patient portals because it gives us instant access to our medical records. And if you haven't signed up for your patient portal, sign up for it now, because that's the only way both Mainline and Penn is contacting their patients. So whatever system, Christiana, Penn, Mainline, Delaware County, whatever system that Crozier, whatever system you have ever encountered, sign up for their portal. You could have 3 portals, and that's fine. So I would say register with all of those ways. And when there is enough vaccine for the next phase, the invites will start going out and you'll hear it. So being patient is hard, but that's what we need to do right now. And we will get to everybody. I mean, from the way, it's really incredible. Mainline Health received its first batch the second week of December, and it has only been about a month, and just over a month, and we've vaccinated 14,000 people.
Good.
It's really incredible. I mean, it just takes some time. Oh, the last place is on the Pennsylvania Department of Health. That one is really hard, and I don't know if anybody else have had success, and feel free to chime in. But there's a map with little green dots and red dots, and the green dots are supposed to indicate that that facility has the vaccine. And when you click on it, it brings you to either a link or a contact, and you can try to do it through that way. I haven't seen anybody with any success with that, but that's the other way that you can also register.
Yeah, I know. We actually get calls, we're getting calls, Dr. Li, of women just saying, hey, I'm trying to find where to go. I drove here, I drove there, because there's these trackers and they can get on an app and see this tracker. And it just feels like, it's undue stress, right? So the ways that you told us to register, and then hopefully we'll get our ticket, and to be patient. And then the last one that we have, once I get the vaccine, do I still have to wear a mask?
Oh, absolutely. So this is what we know from the trials with the vaccine. The 95% is to prevent symptomatic COVID. And you have heard plenty of times that there is a lot of asymptomatic transmission. So we don't really know, because the trials didn't track asymptomatic COVID positive. So we don't really know whether you would still get an asymptomatic version of it. In other words, you have it, but it doesn't bother you. It's very important to still do social distancing and wearing a mask, because if you have it and you're asymptomatic, you could still pass it on to somebody who might have not had the vaccine and still could die from it. So until we have more information, until a much bigger portion of our population has been vaccinated, all the social distancing measures and the mask and cleaning your hands, all of that still is in place, just to protect our entire community and to protect our family members. And
Okay. Terrific. Well, they are our 10 questions, and then we took more. So Dr. Li, thank you. We really appreciate the community. Thank you all. A lot of love coming your way, Dr. Li, from our community. Thank you for doing this. A lot of good information, and just, we appreciate you setting us straight. We're getting the facts and being very clear. So thank you all.
My pleasure. Exciting time. Be patient and get your vaccine when you can.
You got it. You got it. All righty. And if you guys have any questions in that chat, put them in there. We always have people monitoring our social media, and we will answer them. And if we don't know the answers, I know where to find her. All right. Thank you. Have a good day, everyone.
You too. Have a good day.
Bye-bye.
Bye.